All right. So which of the following arteries is most likely occluded in this patient? So we've got a 65-year-old man. He has hypertension. He has sudden onset left-sided weakness, difficulty speaking. He's got a CT shows a small area of infarct in the right basal ganglia. Okay. So let's see. So it gives me anterior cerebral artery, anterior choroidal artery, the lenticulostriate artery, middle cerebral artery, and the posterior cerebral artery. Okay, so I'm immediately trying to remember my anatomy knowledge and like the circle of Willis.
Okay.
So, and I'm trying to remember, I know that there is a more likely, let's see, he's got a small area of infarct in the right basal ganglia. Okay, so I don't know where the right basal ganglia is, um, which is unfortunate because I feel like that would help me out a lot.
Sure, sure. So
Um,
so let's say, especially when you're doing MD boost questions and you're starting out, I would say that one of the things that can help us is this little button right here. It kind of helps get you down to at least two, but just to kind of help you out so that you don't get too discouraged much, but just so you remember that that button's there. But yeah, definitely not knowing where the right basal ganglia is going to be an issue. But let's just start kind of easier. Is the right basal ganglia, is that deep or superficial in the brain? So is it on the outside of the brain or the inside of the brain?
I am not sure.
Okay. 50-50.
I'm gonna go with it's deep. I'm gonna go with the other one.
Inside or outside?
Oh, you said inside or outside. I'm gonna go with inside.
Yeah. Okay. So it's deep in the brain. Okay. The right basal ganglia, it should be relatively deep inside the brain. And so then that can help you on a sense of, okay, so which one of these arteries supplies something deeper in the brain? The lenticular striate artery or the posterior cerebral artery, you think?
So I have not heard of lenticulostriate. I know that posterior cerebral artery is somewhere around the circle of Willis, which is kind of the inferior portion of. Oh, I'm gonna go with posterior cerebral. I think that's pretty centrally located.
Okay, so it's actually lenticular striate. Okay, so
Okay.
lenticular striate goes deep into the brain, right? And it's a smaller artery, which is why it hits the right basal ganglia. Posterior, middle, anterior, right? Posterior, middle, anterior cerebral arteries. Those are your big vessels, and you're gonna have a lot of issues. Okay, so anterior cerebral artery, right, is all the way at the tip top. Okay, that's how I remember it, right? And this usually does your legs. Okay. And lower extremity weakness and sensory loss of your lower extremities, like your feet and your shins area for your anterior cerebral arteries. Your middle cerebral arteries, right, is it consists of almost a lot of things, right? Usually in contralateral hemiparesis and sensory loss, as well as aphasia and the dominant sphere affected. So, for instance, if it's on the left side, right, if it's your left middle cerebral artery, then you're going to have a right-sided issue with face, trunk, and everything besides your lower extremities, which is your anterior cerebral artery, and your posterior cerebral artery is your occipital lobes and parts of your temporal lobe. So you're gonna get vision issues mainly with your posterior, and then your choroidal artery, right, supplies the optic tract, posterior limb of the internal capsule and part of the thalamus. Occlusion causes hemiparesis, hemisensory loss, and visual defects. A little bit of vision because your choroidal artery, is kind of where your eye is. So but yeah, your lenticular arteries, small branch of the middle cerebral, basal, and internal capsule. Okay. So this is an anatomy question, of course, like I said, right? Key thing is just kind of learning from it. Getting the big points. What questions do you have? I know I'm going through a lot very fast, but what questions do you have on this?
I mean, it is all pretty straightforward. If you know where the right basal ganglia is located, and then you know what artery supplies that area, you should be able to get to the right answer. So if I go back and study my anatomy on this, I think I'll be okay.
Perfect.